Hi, guys. Welcome to our live session. Fertility issues are at a rise. There are plenty of reasons why, and that's exactly what we're discussing today. We are in conversation with Dr. Ashwini S, who is a senior consultant and head of Department of Reproductive Medicine, NU Fertility at NU Hospitals Bangalore. Welcome, ma'am, to this live session.
Yeah, thank you, Mega.
So I think it's only right to begin with the pertinent question that we all know that fertility rates are rising globally. Problems with fertility are rising globally. What do you think are the reasons for this?
See, there are multiple reasons, most important being the women empowerment. See, most of us want to finish our education, and by the time we settle down, we'd have crossed the peak fertility age, which is about 24 years. That's when most of us are at our peak of fertility. So, by the time we finish our education, work, and career, and all those things, this has led to delaying our fertility beyond 30 years of age. So, that is one of the main reasons worldwide for decrease in the fertility. Apart from that, we're also seeing an increase in environmental pollutants, toxins, and so many other things which we commonly see in our vegetables, and day in and day out, we are consuming them. So, and globally also, the sperm counts have come down drastically. So, even WHO before used to give a cutoff as 20 million as the minimum sperm count required for fertility. But now, because it is globally coming down, even they have decreased the cutoff to 15 million per ml. Okay,
Okay.
so the reason being unknown, probably like it's again related to environmental toxins or the pesticides and all that we are consuming day in and day out. But the main concern and the main reason for delaying the decrease in the fertility is the age at which we are considering to be considering the conception. So, women's age is the most important determinant of fertility, and that is when it is raising. See, if we look back to our parents or grandparents, by 20, they would have completed their family, and by 22, 23, they would be almost done with their families. And
Yeah.
the thoughts are in such a way that our family starts only after 30. Very few
Hmm.
people conceive before 30 as well.
Hmm.
So
Hmm.
peak of female fertility is around 22 to 24 years. After
Hmm.
that, irrespective of what we do, the quality and quantity of the eggs, everything starts declining. So that's one of the main reasons for decreasing fertility worldwide.
Okay. So would you say then that the right age, or rather biologically, the right age, the most fertile age for a woman to conceive and to have children is between the ages of 20 to 25?
Yeah, actually, like we are made to conceive and reproduce in that age, but I cannot
Hmm.
advise everybody to conceive between 20 to 24. But at least
I know.
30 is good enough. But and if you are delaying, what I would advise is get a fertility checkup done and see
Hmm.
where you stand. Is there any option to delay your fertility? How far it is going to affect your fertility after that? So you need to go through a preconceptional counseling in case you're delaying your fertility. See, not
Hmm.
all women start declining their fertility after 25 years. Some are
Okay.
okay, so but most of them do. So, whenever you're considering a delay in your planning of pregnancy, so I would suggest you go for a preconception counseling, see where exactly you stand, and then take a decision. So, what happens is like women are born with a limited number of oocytes or eggs, what we call, unlike the sperms which every day they keep coming out, and it doesn't get depleted. Sperms don't get depleted, but women are born with a very limited number of eggs, and every month to ovulate one egg they would be spending at least thousands of them. So they just degenerate and they don't grow into a phase where they ovulate. So whatever
Hmm.
is there, every month it starts depleting, and at a stage when you exhaust everything, that's when you get your menopause. Okay, and it's not that you have to complete your family at 30 years. Now you have so many options, and for some reason, if you really want to delay and your fertility clock is already ticking, you have the option of social egg freezing. So wherein we stimulate the ovaries, take out the oocytes, and preserve it for future use. And you can, if you're already married or if you already have a partner, you can even go for an embryo freezing. So whenever you're ready and whenever you're ready to plan your family, you can go ahead and transfer those embryos.
Okay.
So there are various options available. I would not recommend everybody to start their family by 22, 25,
Yeah.
but
Yeah.
definitely preconceptional counseling is required. And there are other options which you have to consider if your fertility is already declining and still you want to postpone your pregnancy.
Okay. We are also in the middle of a pandemic, and you just spoke about the different reasons why fertility rates are declining. Do you think that the coronavirus, the infection or the pandemic, either or both things have a role to play in fertility too?
Coronavirus is a very new thing for us. We only have about a year or so of experience with that. But what we have found is the coronavirus is also found in the semen. Semen samples have been found to have coronavirus, the effect of
Hmm.
which we really don't know on fertility. But the other thing is, looking by our experience, whatever we have had in the past 1 year, it doesn't seem to be affecting the fertility as such. But once the women conceives, especially in the second wave, we have had a chance to see more of abortions, more of intrauterine deaths. We really don't know the correlation between COVID and this, but definitely we have to be cautious. And what I would suggest is get vaccinated before you plan your pregnancy, and that's the safest way to prevent the infection.
Okay. Are there any lifestyle factors that should be regulated to avoid fertility health issues?
Definitely yes. Okay, so we are in the 22nd century and 21st century, and like most often, a sedentary lifestyle is what is contributing to obesity. Obesity is
Hmm.
rampant and it's like everywhere. Okay,
Hmm.
all women are
Hmm.
concerned about weight loss and obesity, and it's one of the major factors affecting the fertility. See, when you're
Hmm.
obese, your system is such a way that it usually inhibits ovulation. So you
Okay.
don't ovulate more frequently, and it delays your menstrual cycles. Many a times you don't get it without tablets at all. So it also
Hmm.
increases some of the androgenic hormones, which can affect the fertility. So overall, obesity is something which you have to take it into consideration. The optimum BMI for anybody who's trying to conceive is between 18 to 24. And
Okay.
that said, obesity, apart from affecting the fertility, it also causes plenty of problems during pregnancy. So women who are obese, they're usually prone for first trimester abortions or the early abortions. They also have a higher chance of getting diabetes in pregnancy. Even though they are not diabetic when pre-pregnancy, during pregnancy they may start getting high sugars, and that indirectly can affect the mother as well as the baby.
Hmm.
They're also prone for high blood pressures.
Hmm.
They're also prone for difficult and traumatic deliveries, higher incidence of cesarean section, higher incidence of wound infections. So everything is going to be a problem. So weight is something which we have to take into consideration before getting into pregnancy. And that said and done, it's not easy to lose weight also. So it has to be
Yeah.
a gradual process. You have to set your targets, and most importantly, most of them try to take shortcut methods. So keto diet,
Hmm.
that diet, this diet, there are plenty of them in the internet. But what I
Hmm.
would suggest is eat healthy, have a proper breakfast, have a proper lunch, cut down at dinner a little bit because you're going to
Hmm.
be sedentary in that time,
Hmm.
and
Hmm.
watch on your calories, what you eat and what you spend. So cut down on the junk foods, what you take in between, coffee and all the other sugary drinks. They are the ones which contribute to more calories than the breakfast and the lunch. So apart from that, whatever you do, workout is very important. So
Hmm.
most of the women who come to us when we say weight loss, they say I walk half an hour in the morning or 1 hour in the morning, and still I'm not reducing weight. Actually,
Hmm.
like when you actually see when you walk for half an hour or 1 hour and see how much of calories you have spent, it's something like 200 to 300 calories. So that's not just enough. You have to cut down on your intake, especially the junk food, and also keep a realistic expectation. If you're losing some 5 kgs in a month, that's going to be very difficult. You keep 1 or 2 kgs in a month, and gradually it has to be brought down.
Hmm.
And there are
Okay.
some people who are morbidly obese. Somebody with a BMI of 35 or more who's already crossed 100 kgs or something like that. It's very difficult for us to tell you lose weight, you do exercise, you stop eating
Hmm.
and all that. That will like that's not going to happen with them. Okay. So
Hmm.
in such patients, we have an option of doing a bariatric surgery. So bariatric surgeries
Hmm.
is something which has evolved over the recent past, and they're quite safe in the recent years. So what they do is do a surgically, they reduce the size of the stomach so that whatever you eat, you feel little you eat, you feel that you're satisfied, and you don't have that craving for food. So gradually, the weight loss over a period of
Okay.
6 months, they can target at reducing something like 25 to 30 kgs. So, but they require a lot of
Okay.
pre-surgery counseling, because after the surgery, many of them would be put on a liquid diet. Okay, so they have to be mentally prepared to go through that, and whatever their appetite, everything starts coming down. So they have to be counseled appropriately before they go in for the surgery. And it usually takes about 6 months to 1 year for the body to get adjusted to that. And only when all this has happened, we advise them to plan for pregnancy. So there are plenty of
Okay.
options, even for morbidly obese people. So they have to take an expert consultation and then take into consideration the options. So apart
Okay.
from that, smoking and
Mm-hmm.
alcohol, again the culprits. Smoking is
Okay.
like highly underrated. We see many women smoking these days, and they think it's okay to smoke because as long as you're not pregnant, it really doesn't affect your fertility. They keep a target: as soon as I conceive, I'll quit the smoking or something like that. It doesn't happen like that. If you're smoking consistently, then it definitely reduces your ovarian reserve, and it definitely affects your fertility as well. So it's better to cut down on smoking whenever you're planning for pregnancy, and definitely
Okay.
no smoking in pregnancy as well. And most important, the partner who smokes also has to be taken into consideration. Passive smoking is equally important when considered when compared to the active smoking. So counsel the partner also not to smoke in the house or in front of the wife, or at least if possible quit smoking.
Yeah.
Alcohol, yeah, there's no definite level of alcohol which can affect the fertility or the pregnancy as such, but definitely it has to be at moderate levels when you're trying to conceive.
So you need to take care of your weight. You need to have a healthy diet, work out, avoid smoking, at least when you're trying to conceive, and definitely when you're pregnant, and keep your alcohol level to a minimum. Or if you can
Minimum,
avoid
yeah.
nothing like it.
Yeah, yeah,
Okay.
that's it.
Also, are there any symptoms that a woman should look out for which tell her that her reproductive, health isn't all that great? Or is there any way for women to preempt that, my reproductive health is not in a great shape?
See, infertility doesn't always show up as symptom. So, if a couple is trying regularly for about a year or so, and if they've not been able to conceive, then definitely there will be an issue, and they have to contact a fertility specialist. Also, if somebody is more than 35 years of age, all the more they have to consult a specialist if they've tried to conceive for 6 months and they fail to do so. And if there are any obvious factors which can cause infertility, for example, if they've had tuberculosis, if they've had repeated pelvic infections, if the man has some surgery in the scrotum, or they could be having a torsion of the testes, or some obvious things which very well we know that they could be infertile, they are the ones we should consult the fertility specialist at the earliest. Apart from that, there are multiple reasons for infertility. So, one of the things which you can watch out is the menstrual disturbances. So most
Okay.
often, any disturbance in the ovulation, it usually shows itself in a menstrual irregularity. So if somebody is getting periods in once in 2 months, once in 3 months, definitely they are not going to ovulate on their own, and they need help from the expert. So they are the ones we should consult the specialist. And
Okay.
not only the long cycles, even the short cycles are a concern. You were previously getting 30 days cycle, and suddenly you started getting 26 days or 25 days cycle. That is also something which you have to be concerned about. That may point towards your decreased ovarian reserve, and if you're not being able to conceive, that also should be taken care. And many women do have excessive pain during periods. So this is
Yeah.
something which could be physiological, which also could be related to endometriosis. Endometriosis is something where you have blood-filled cysts in the ovaries, and it definitely impairs your capability to conceive. And that is also something which you have to consult a specialist. So apart from that, there's no other obvious thing. So if you're not been able to conceive for 1 year, definitely you should take a consultation and see if everything is all right before you go ahead.
So we've just had a question, uh, and this question, Ayushi wants to know that if somebody is taking menstrual painkillers, like pain relieving medicines for period cramps, especially severe period cramps, which face it, many women end up taking. Can that have any effect on fertility as well?
So not really. So if you're taking painkillers for menstrual pain, that will be in the early part of the menstrual cycle. That is the time when you don't ovulate, and it's very safe to take the painkillers. Especially we give antispasmodics like
Hmm.
meftal or something like that.
Yeah.
That is quite a safe drug. But what I would suggest is sometimes in the middle of the cycle when you're ovulating, you start taking painkillers, what we call as NSAIDs, Brufen and all that things like that. So they are the ones which can affect the egg quality and the ovulation. So in the middle of the cycle or whenever you are ovulating, those are the periods when you should avoid painkillers and you should opt for a safer one, preferably something
Okay.
like paracetamol. Yeah.
Okay. Okay. All right. So, are there any underlying medical conditions which can also impact fertility health?
Yeah, to some extent, if you're hypothyroid or hyperthyroid, that is something which can affect your ovulation. Apart from that, it also affects the pregnancy in multiple ways. So,
Okay.
though we don't screen routinely, but if there are any obvious symptoms, we screen patients for thyroid symptoms. And thyroid has to be optimally treated before they go into pregnancy. Apart from that, again, diabetes is something, though it doesn't affect the fertility as such, once you conceive, it can have tremendous effect on the fetus as well as the mother. So there's a very high chance of baby being abnormal, the congenital abnormalities increase in number. So before you enter a pregnancy, diabetics should take care and see to it that the sugars are under control. What we measure
Hmm.
is HbA1c. That's a blood test which measures the control over the past 3 months. So that has to be preferably kept below 6 or 6.5 when they get into pregnancy. So this
Okay.
avoids much of the complications to the fetus. Apart from that, many of the drugs which these patients take are teratogenic in the sense they can cause anomalies to the baby. So these drugs have to be reviewed before they get into pregnancy and changed into a safer ones. So they, whenever they're planning a pregnancy, they should go for a preconceptional counseling and change the medications as well and get on to the safer ones. Again, if they're
Okay.
obese, they have to reduce the weight that drastically reduces their sugar levels. That has to be done much before they get into the pregnancy.
Okay. Are there also any drugs, be it prescription drugs, because of pre-existing conditions or otherwise, which could have impact on fertility? I know we just spoke about painkillers, but I'm just wondering if, let's say, somebody has diabetes and they're taking medications or medications for thyroid, can they also impact fertility?
Plenty of drugs can affect the fertility as well as the fetus. See, more than fertility, we are concerned about the teratogenic effect on the fetus. That means many of the drugs can cause congenital abnormalities on the fetus. So, whenever they're planning for pregnancy, trying for pregnancy, we always advise them to take preconceptional folic acid. This is because many of them think that they're taking folic acid so that it's going to help them becoming pregnant. So it's not
Yeah.
so. We give folic acid to prevent the neural tube defects, in the sense the brain and the spine abnormalities. See, all these abnormalities, they start, all the brain as well as the spinal cord, it starts developing by 4 weeks of pregnancy. And by the time we miss the period and we test for pregnancy, it will be almost like 5, 6 weeks, 1.5 months or something like that. So we
Yeah.
would have missed that window where we can prevent the abnormalities of the brain. So that's the reason most of them should start taking folic acid beforehand. Apart from that, most of the drugs are classified as category C or category B, which can cause abnormalities in the baby. So whenever you're trying for pregnancy, you should always tell your doctor before going ahead with any kind of medicine that you're trying for pregnancy. So if there's an option to give the safer one, they'll change over to the safer one. Most of
Okay.
the antibiotics you take are not safe for pregnancy. At the same time, even the medicines which you take for epilepsy, most of them are teratogenic. They cause severe defects in the baby. So they have to be switched over to the safest ones. And most importantly, the drugs which we take for hypertension as well. Many of them
Yeah.
can cause severe kidney problems in the fetus. So that also has to be reviewed at least 1 or 2 months prior to planning an attempt or attempting a pregnancy. That should be changed over to a safer one. Apart from that, sometimes we take isotretinoin or medications for acne. They are
Yeah.
highly teratogenic, and we advise them at least for 3 months you should not conceive once you're taken the medicine. So more than fertility is mainly because it can affect the baby in multiple ways. And the other thing is the chemotherapy. So most of the chemotherapy drugs and the radiation what they take for cancer treatment, they also affect the ovarian cells. So basically, all this chemotherapy and radiation, it's targeted at highly fast dividing cells. So even the cells, germ cells in the ovaries are also fast dividing. So whenever chemotherapy is targeted at some cancer, it also affects the ovaries. So whenever So now, because the awareness has increased and most of the women with cancer are doing well and they're getting into the reproductive phase, they're getting cured and they're planning to start their family, we have to take this seriously. So most of the oncologists, before they start chemotherapy or radiation, they usually send the patients for fertility counseling. So if they've not started the family yet, what we do is we stimulate the ovaries before they go into the chemotherapy. We collect the oocytes or the ovarian tissue and freeze them for future use. So this is something which has to be seriously considered, because once you take chemotherapy or the radiation which is specifically targeted to the abdomen, conception is going to be very difficult after that.
Okay.
So they have to do fertility preservation. There are multiple fertility preservation methods which are available, and they have to opt for that in case they're going ahead with any of these things.
Okay. We have a very interesting question from Dipali on PCOS, but before we go ahead and answer that, I would like to take you back to something you said about, isotretinoin. Uh, while it is an oral medication, a lot of people also use retinol in its different forms on the face for acne as well. So, is it that topical application can also impact the fetus, or is it just when taken orally, this medicine can cause problems?
No, topical, it doesn't get absorbed systematically. So topical should not be an issue, and that should not be this thing to terminate the pregnancy. But oral, when you take the oral medication, it gets into the system at a higher dose. So, and that is definitely going to affect the fetus. Most of the topical medications, they don't get absorbed that well into the bloodstream. So there's no contraindication for them to terminate the pregnancy if they've been using topical retinoids.
Okay. But if you're taking it orally, then it's going to be a
Yeah,
challenge. So we
only
need
yes. Yeah, yes. We don't allow them to continue the pregnancy. Yeah.
okay. All right. So Dipali is asking, and I'm sure many people, many women have this question too, that if someone has PCOS, then what complications can they expect when it comes to, trying to getting pregnant?
Well, let me clarify first what is PCOS, because women just petrified when they see the scan and finding of PCOS and they just come running over. See,
Yeah.
PCOS or PCOD is a condition wherein your ovaries are born, you're born with more number of eggs in the ovaries. So that comes with a little bit of hormonal disturbance as well. And not everybody who has PCOD by scan will have symptoms and will have problems in their problems related to that. So, what is PCOD? It just means that you have plenty of oocytes or plenty of eggs in the ovary. So that means that you tend to reach menarche early and reach menopause late. That is one thing related to that. The other thing is, when you have too many oocytes, you don't ovulate regularly. So instead of 30 days cycle, people will get the 45 days cycle, the 60 days cycle, or sometimes they don't get a period without tablets at all. So that's a spectrum actually. So you have somebody who has PCOD and still they're normal. Somebody with PCOD with different kind of symptoms. So the symptoms include, one is the menstrual irregularities. The other one could be something related to the high androgens. So these PCOD patients, they have marginally elevated androgens or the male hormones in their body. See, all of us do have some amount of male hormones in our body. So these people have marginally elevated androgens, and that causes increased androgenic symptoms like excessive facial hair growth or things like that. So that could be one of the troublesome things. And apart from that, some of the PCOD patients, because they're not ovulating, they may have problems in conceiving as well. So you can't treat PCOD as such, but you have to treat the symptoms associated with it. So if there are menstrual irregularities, what happens when they don't get their period in 1.5 months, 2 months, 3 months? Whenever they bleed, they tend to bleed very heavily, and so such patients have to be given medications to regulate their period. But what happens is, when you tell them to take medications, they're not in a mood to take. They feel that you're taking hormones regularly, continuously for 2 years, 3 years. That may cause side effects in the long run. But in fact, if you're taking adequate, what we normally give for periods is progesterone, short duration of progesterone. That's completely safe, and these people have to understand that if they don't get their periods every month, not every month exactly, at least every 2 or 3 months, that's the one which is going to give them trouble when they turn out to be in their 40s or 45s. So there will be continuous estrogen exposure in such patients, and this can cause to endometrial hyperplasia or precancerous conditions when they are in their 40s or 50s. So whenever you have irregular cycles, 2 month cycle, 3 month cycle, I would still advise them, you take 5 days of progesterone as prescribed by your doctor and get your period. So it's not safe to leave it for 6 months, 1 year. One thing is you'll have problems when you're in your 40s. The other thing is whenever you bleed heavily. If you leave it for 2 months, 3 months, 4 months, and all that. So whatever
Hmm.
medications we are giving, they're completely safe, and you consult your doctor and take the medication as per their prescription. So there's no long-term side effects of these tablets what we give for their periods. That's one thing which they have to understand. The other
Okay.
thing is coming to the androgenic symptoms. So it's very troublesome for women when they get excessive facial hair and things like that, acne and all such things. So again, it's a symptomatic treatment. So we can't reduce the androgens. It is going to be like symptomatic treatment for acne, and as well as like whenever you have excessive hair growth, we have to resort to cosmetic treatments like laser or things like that. To some extent, we can reduce the effect of the androgens by giving drugs and hormones. So, and but they're all going to be short term. Okay. The other thing is when it comes to fertility, the main reason why they find it difficult to conceive because they don't ovulate, and these people are very sensitive to weight as well. So sometimes even they would be getting regular periods, and if they gain some 2 or 3 kgs of weight, it starts becoming irregular. So that's how sensitive they are to weight gain. So these patients, first thing, if they're obese, we ask them to lose weight. Many of them conceive on their own. If that doesn't happen, we'll have to start inducing the ovulation. We give certain medications to grow the eggs and track the egg growth by follicular monitoring, and ask them to try whenever they're ready to ovulate. So that's a very simple thing which we do for PCO patients. So my advice
Okay.
is don't get scared because you have PCOD. It's just that you have too many eggs in the ovaries. All you need is lifestyle management and management of your symptoms.
Okay. All right. There is also this, recently you hear or read a lot about how young women now are getting diabetes. How should diabetic women then plan their pregnancies?
Yeah, most important thing is most of these diabetics are obese. See, we have type 1 diabetes, type 2 diabetes. Type 1 diabetes is something which is congenital and we don't see that that often. They are usually with insulin, and that's a different entity altogether. Most of the
Hmm.
type 2 diabetes, it is multifactorial. One is they have a genetic tendency to get this diabetes. The other thing is if they become obese, they'll start developing the insulin resistance, and that's when their sugars start growing high. So most important thing for them is before they embark upon getting into pregnancy, they should lose their weight and get into the optimal pre-pregnancy weight. Their BMI should be somewhere between 18 to 24. So apart from that, the sugars have to be checked regularly, and we should aim at getting a target HbA1c of less than 6.5 before they attempt a pregnancy. And most importantly, whatever medications, they'll be on multiple medications. So that has to be reviewed, and most of the oral medications are not safe. So there are only a few medications which are safe in pregnancy. So these medications have to be switched over. And if required, with these medications, if the sugars are not getting controlled, we even start insulin when they're planning for pregnancy.
Okay. All right. Now we've spoken a whole lot about women with PCOS, women with endometriosis, women with diabetes. But what about men? Like, are there any signs which can let a man or rather a couple know that the male partner might be having fertility issues too?
See, men almost contribute to about 50% of infertility, which is usually underrated. And most of the times, we target the women and keep diagnosing them or doing multiple tests and all that. So, usually, there are two things here. One is the sexual function or the sexual dysfunction, the other one could be the semen abnormalities. So, both of them can lead to infertility. If they have an erectile dysfunction, or if there is any obvious sexual dysfunction, they will be knowing it, and that's when they have to consult an andrologist. Most of them can be easily treated with adequate help. The other thing is if there are any semen abnormalities, most of the times we don't get to know unless we test the semen. So there's no symptom as such which tells us that this man is having a low sperm count, or this person is having a high sperm count. So whenever somebody approaches for fertility or even preconceptional counseling, we always get one baseline semen analysis done. Again, if they're
Okay.
smoking, that could impair the sperm parameters highly. So motility, morphology, everything starts getting affected with smoking. So if they're planning for pregnancy, I would advise the men to cut down on the smoking and then plan the pregnancy.
Okay. I think before we move forward, I would also want you to shed some light on endometriosis because, of course, that is something, like you said, which does create problems when it comes to conceiving. So, If, let's say, a woman has endometriosis, what should she do if she wants to have a child?
Yeah, endometriosis many a times it goes unrecognized. So usually it presents with period cramps or menstrual cramps. So most of them think that it is very much normal to have cramps in pregnancy, cramps during menses. So endometriosis, we should understand, it's nothing but a chocolate colored or blood filled cyst in the ovaries. So whenever a woman menstruates, the way the bleeding happens through the vagina, some amount of bleeding also goes through the fallopian tubes and into the abdomen. So most of the women clear this blood or the endometrial tissue which goes there. It doesn't allow them to implant everywhere. But some women, because of some reasons, we really don't know what is the reason, but they start implanting wherever the endometrium or the blood goes there. So they don't adequately clear the menstrual blood from the abdomen. So this is when wherever the lining goes, it starts implanting there, and they usually respond to hormones. Every month, like the endometrium responds, the uterus responds, and you grow the endometrium, then shed it during periods. Same thing happens inside the abdomen also. So whenever somebody has endometriosis, every month they keep bleeding in these endometrial tissues. So whenever these tissues are there in the ovary, that bleeding blood starts collecting there as a chocolate cyst or blood-filled cyst. So this is very easy to find out by ultrasound. So we can pick up this chocolate cyst or endometrial cyst in the ovary. But many a times, if it is not in the ovary, if it is some other place in the abdomen, what happens every month they bleed and it causes some kind of an inflammation. But because it's an open cavity, they usually don't collect blood anywhere. Because of the healing, all the tissues start getting adherent to one another. So that is something which we cannot see by scan. We have to symptomatically, we have to be come to diagnosis based on the symptoms. And many a times when we do laparoscopy for unexplained infertility, if somebody everything is normal but still they're not conceiving, that's when we find these endometrial spots in the abdomen. So these kind of endometriosis, they usually don't, they're not visible by even ultrasound. So
Okay.
what happens, how it affects the fertility? One thing is it has effects on multiple things. It affects the egg quality because of the adhesions it causes. It can pull the tube. It can distort the pelvic anatomy so that optimal egg capture doesn't happen from the fallopian tubes. It can also affect the implantation. So there are multiple ways in which the endometriosis affects the fertility. So usually, when somebody tries naturally, they usually have about 15% chance of conceiving every month. With endometriosis, it's something like 8 to 10%. So because it has an effect on multiple factors there. So that said and done, if somebody has infertility, somebody has severe menstrual cramps, they should be consulting a fertility specialist. Probably they could be having endometriosis, which we have to look into. And many a
Okay.
times it's asymptomatic. When we do laparoscopy for some other reason, we find this endometriosis is almost 20 to 25% of patients. We find these
Okay.
endometriotic spots in the abdomen.
Okay. All right. So if you do have endometriosis, then you need to talk to a fertility expert, a fertility specialist, to figure
Yeah,
out what
yeah.
I stop.
Most often it presents as unexplained infertility. People come and ask, everything is normal, my ovulation is normal, husband's sperm count is normal, fallopian tube is normal. Again, still I'm not able to conceive. So endometriosis is something which can present as unexplained infertility.
Okay. All right. So that's something to note that, if everything seems normal but you still can't conceive, there are signs of infertility and you can't understand why it could be endometriosis and you
Yeah,
must talk to an expert.
yeah,
Okay.
that's right.
Right. So a very interesting question has come from, Anjali, also very pertinent. She asks, has the procedure of treatment changed during the pandemic? For how long should someone wait after recovering from COVID before they can start their fertility treatment?
So if they had mild COVID symptoms, I would say at least 3 months wait should be. They have to wait for at least 3 months before they go in for fertility treatment. If they've had a severe COVID, then again it all depends on their recovery stage, and at least three months from the time they are completely recovered, they have to plan the pregnancy. And if they have to get vaccinated after 3 months, they have to take the vaccine. Before that, we don't advise because already they have antibodies. So I would suggest they get vaccinated and then try for conception or fertility treatment.
So can you opt for fertility treatment immediately after getting a vaccine or should you wait a little bit?
2 weeks wait should be sufficient. After second dose, 2 weeks of
Mhm.
wait should be sufficient. You can go ahead with your fertility treatment after that.
Okay. All right. So, Adil, I'm sure in your career you must have come across so many myths when it comes to fertility and conception. Can you answer some of them for us? Like, could you tell us what are the most ridiculous things rather that you heard when it comes to infertility?
See, most important thing is infertility is definitely rare and it's not for me. That's what people think. They think that they will be using contraception for years together and they think that as soon as they start trying, they'll conceive. So that's not the case. It's not that rare. Almost like 15 to 20% of women who are trying to conceive face infertility. And as soon as you start trying, it doesn't happen. Every month, even though everything is normal, even though you ovulate, even though your ultrasound is normal, your husband's semen analysis is normal, only about 10 to 15% of them conceive. So you
Okay.
have to have some patience, try for at least 8 months to 1 year, and then only you say that you have a difficulty and you go get an assistance. The other thing is, in the most of them think that it's okay for them to postpone their pregnancy in the era of IVF. So you have the assisted reproductive techniques, you have IVF, you can get pregnant anytime you want. So it really doesn't matter when they're going to plan. So sometimes they go even up to 38, 40, and they think that it's okay, they can have the IVF and get a pregnancy. But that's not the way. So even in IVF, the age definitely affects the success chances. Yeah, it affects the numbers as well as the quality of the eggs we get, quality of the embryos, and definitely the IVF success rate. So whatever 65% or 70% success we get when somebody is less than 25 or less than 30, when they go to 40, it becomes something like 20 to 25%, almost half of what you get normally.
Of a sharp
So
decrease.
yeah, yeah. So that's something you don't be under the impression because you have IVF, you have assisted reproductive techniques. You can plan your pregnancy whenever you want. It doesn't happen like that. So the other thing, most important thing is most of the men think that it's not for them. Infertility is only for the female who has to go through
Yeah.
all the things and get evaluated. But all men has to they have to remember that 50% of the infertility is because of the male factor. So it could be various reasons. It could be the low sperm count, it could be the low motility or the abnormal morphology, multiple things. So it's always better to evaluate both the male and the female simultaneously rather than concentrating on one particular person. And one more thing, what people feel is it's very easy to conceive the second baby because you had no problems conceiving the first one. Second one is also going to be equally easy, and there's nothing much they have to do, and there's nothing much you have to evaluate there. That's not the case. See, if you have taken a long gap after the first baby, definitely you are older than what you were when you were the first when you had your first child. And even when men had normal semen analysis during the first one, they could always be having an abnormal one in the second one as well. So same procedure and same evaluation has to be followed even when you're trying for second pregnancy. If you're trying for a second one and if you're not conceived for a year, so you have to take assistance. You have to go take help. And one more important thing,
Okay.
most of them feel that age affects only the female fertility and men are nowhere in the scene. So it's not like that. So
Yeah.
men are also affected, age affects men's fertility as well, but usually up to 40, 45 years they are safe. Only after that, the fertility starts going down, the sperm quality and the DNA damage, everything starts going down. So for men, the cutoff is a little later, something like 40 to 45. For women, the cutoff is somewhere around 30 to 35. So there's about a 10 years difference. So age can affect both of them equally.
Okay.
And the
All
other
right.
thing I wanted to stress here is most of them feel that they're taking too much of stress in work or office, and that's the one which is hampering their fertility. That's not
Yeah.
always the case. Yeah, because most of them, whenever you see, as soon as they come to the clinic and they start treatment, they say, I'm quitting my job. Why? Because I think I'm taking too much stress. So everybody at home is telling you quit the job. So that's not the case, and I really would not suggest that. So stress, to some extent, it impairs your hormones and it affects your ovulation and other things like that. But definitely, that's not going to be the major cause for your fertility. So there will be other things which you have to take care, and I would suggest not to quit your job because that will make you more disappointed, and all your energy, everything will be concentrated on your fertility treatment itself. So continue with your job, and stress is not going to affect your fertility in any way. So apart from small aberrations in the hormones and ovulation, which can be easily tackled. So these are the things, myths and facts which we have to keep it into consideration.
Okay. So before we bring this session to a close, would you like to give some final advice to men and women listening to this session who have been trying to conceive, but haven't been very successful.
See, if somebody who is trying to conceive, don't be disappointed, don't be disheartened, because we are in an era where we have multiple facilities, multiple treatments. So always seek the right help. So go in a stepwise manner. Some people get a pregnancy in first attempt. Some people have to try a second time. But then, if you evaluate properly, there's always a reason behind it, and there's always a solution for it. So never get disheartened, even if you fail once. So there's always a hope. You have to get back, and like you have to continue pursue with the proper treatment. That said and done, as I said, age is something which again, time and again I'm stressing. So don't postpone your pregnancy for too long. So we all have ambitions, we all have career goals, we all have so many things are there, and there's no end to that. So today you have a goal, tomorrow when you reach there you have a different goal, so that doesn't end like that. So, and we, most of the women who postpone like this at 35, 40, they become desperate because they would have achieved everything in their life, and then they want,
Yeah.
they lose their zeal in life. There's nothing else for them to look for. So that's when they come back, and then they start repenting and all that. So take help, take family's help. So something you have to do, and like you have to be somewhere realistic between your career and your family. So that's something which we all have to learn from the past mistakes. We see it very often in a family, with our friends. So that should be our eye opener. So we should not be postponing it for too long. Have a realistic expectation and plan your pregnancy at the right time. That's equally important. And most of them who say that I never want a baby, I don't want a baby now, 10 years down the line, they are the ones who come back saying that I desperately want a baby.
So the
Yeah.
age is, it's important. And if you're like, let's say, over 35, and it's been 6 months since you've been trying to conceive but have been unsuccessful, then you need to see a fertility specialist.
Yeah, that's right. So more than 1 year, if you've tried and if you're not been successful, you should see. And all the more if you're more than 35 years, 6 months is the cutoff. If you're not conceived in 6 months, you have to go ahead and get yourself evaluated.
Because I'm sure the timely treatment, also makes a difference in how successful your fertility procedures are going to be, right?
Definitely yes. And not everybody needs fertility treatment. Some of them may need a little bit of assistance and they still conceive. It's only a part of the patients who need actually IVF or other advanced fertility treatments. So they don't have to be scared that as soon as you go, they start with all the treatment and unnecessary things and all that. It's not always the case. Yeah.
Okay. Okay. All right. So thank you so much, Dr. Ashwini. This has been really an eye-opening, session. We've spoken about so many things that at least I personally did not know about, and I'm sure our audience feels the same way. Thank you so much for giving us your time today. It was been a pleasure.
Thank you, Meghna. Thank you for making me a part of this wonderful event.